Hello and welcome back to the Modern Pain Physician YouTube channel. I'm your host, Dr. Kent. I'm a board-certified interventional pain management doctor here in Bend, Oregon. And today I want to talk to you about a medial branch block. And so a medial branch block is often ordered by several different providers to try to get information about how much back pain is coming from what's called a facet joint. A facet joint, so if you're looking at a spine, looking at the back of the spine, a facet joint are these little tiny joints that go along the back of the spine. You have these joints from your neck all the way down to your sacrum. What a medial branch block is it is a test. It is simply a test to see how much of pain, either in the neck, in the mid-back, or the low back, is coming from that particular facet joint. The procedure itself involves only injecting local anesthetic. The possible outcomes are it does nothing, meaning that your back pain is not coming from that facet joint, or that injection may provide several hours of relief. This is not the therapy, so this does not provide long-term relief of back pain or neck pain or mid-back pain. It is simply a test to see, is the pain coming from that particular location? So if the person you're working with is ordering a facet block or a medial branch block, what your provider is trying to figure out is how much of your symptoms are coming from that particular joint. And it only treats that one joint, and it is only temporary. If you do get substantial relief, and so from insurance purposes, that means greater than 80% improvement of pain in that area, then you are a candidate for what's called a radiofrequency ablation or a facet neurotomy. In order to get to that treatment part, you have to have two tests. Both tests have to be done on different days. Medicare makes us wait 2 weeks apart to basically validate that that is where your pain is coming from. So you have to have two medial branch blocks before you can have the treatment, which is the radiofrequency ablation. The radiofrequency ablation is the same procedure. The only difference is instead of just numbing the nerve, you numb it up and then you burn it. Radiofrequency ablation, again, only treats back pain. All of these treatments that we're talking about only treat back pain. So if you have leg symptoms, if you have arm symptoms, and your provider orders a medial branch block, we do not expect that arm or leg symptoms to go away. It is only for pain along the spine. The radiofrequency ablation, so if you do make it to a radiofrequency ablation, there is a recovery period after that procedure. And part of the reason is you're burning tissue inside the body. And so everyone heals differently. Typically what I'll tell folks is it can take up to 4 to 6 weeks to recover just from the procedure itself. And it can be quite painful afterwards. And so that's a very common reaction to having that procedure. And it just comes down to it takes time for the body to heal up. But once that healing is complete, then that should take care of your pain from anywhere from 6 to 18 months. And that's 80% of people will be in that 6 to 18 month window. There are outliers on either side, but this radiofrequency ablation, these medial branch blocks, treat only pain, again, from the facet joints. You can burn other nerves in the back to treat different structures, but this is only a facet joint procedure and will only treat pain from those joints. Thanks again for tuning in. Hopefully provide some insight about why you had this procedure done or why this procedure was ordered. Check out my other videos to learn more about what's going on in your back.